most of the time, do you think it's exactly what we're talking about? Is it like they don't do the work, or is it more than that? Or is there different grades of low back pain? You know?
Yeah, there's definitely different grades of low back pain, but it's the what we talked about with posture and shoulder is kind of this is such a broad problem for the entire population, and how bad it is usually different variables of the same issue. So if we were, again, yes, to say that there's a million different things that can go on in your low back. So from a physical therapist, what we would look at is, okay, bulging disc. You hear all these things you might go to the doctor and they might tell you this. You might have x-ray or MRI and they might tell you this. Bulging disc, a herniated disc, a slippage in the vertebrae, which is called a listhesis, which comes from posture a lot of the time. Sciatica, which is a pinched nerve in your low back that'll fire it down your leg. So does all of that matter in how we treat? Some things might matter, some different type of things in how we're treating the acute pain. But if we look at that, again, the overall problem and how we can solve the overall problem of what caused that in the first place, it usually goes back to the same thing, that is posture. So let's stop real quick and say, if you have a shooting pain down your leg, that's one thing that a very common problem with low back, right, is the sciatica.
Right.
Pain in your butt, pain down the back of your leg, the side of your leg, stuff like that. The only thing that changes for us is how we're going to treat that when you come in acutely. So when you're in that pain, you're like, man, I can't even put pressure on my leg because the pain's just firing down there. So one quick thing we'll say, especially in the younger population, when you're looking at sciatica.
Could you take your phone up for a minute? We lose you because it's against the carpet.
Oh, my sound? The sound?
Yeah, there you go.
All right, so here's what I'm going to show. So I'm going to show that cobra, because when you're talking about sciatica or any type of pain that starts to go down your leg, into your butt, down your leg at all, numbness in your foot, pain behind your knee, all that stuff a lot of times from the low back, whether someone calls it sciatica or not. So one of the main things we do is a cobra, because you're thinking of, when we talk about getting the pain out of your leg back into your low back where it's coming from, we think about a direction, either bending forward in flexion of your low back, so bending your low back, or extending your low back. Now in the younger athletic active population, the answer is usually extension. Once you start getting older, and the problem, that's because of it's more of a disc problem, but once you get older, it's more of a degeneration problem where you're losing height between your disc, and then for that, flexion works. None of this matters, but I'm going to show you one thing. None of what but so with the cobra, you're here doing, right, coming up. So everyone knows that you want to do that repetitively. So that repetitive extension of your low back, that's something you want to try if you have pain down your leg. And that's something you would know right away. Say you did 15 of those, a little hold at the top, little 5-second hold. You did 15 of them. And if that brings the pain or the numbness out of your leg, maybe out completely, or back into your low back, where you have a little bit more in your low back and a lot less in your leg, that's a successful thing that you want to do a few times a day throughout that day, until you kind of get rid of that into your leg, and it might be centralized to your low back. So when we treat symptoms in the low back, yes, if it's something like that, we're going to look at, okay, what can we do to get you out of this acute pain? And that's just a little trick. And that's usually for like the 60 and under population. Usually when it's in the older population, you want something that's going to bend forward to get rid of that pain in the leg. So you have the same pain going into your leg, but if you're into your 60s and older, it's usually a different problem that needs a different type of motion to open up the space. So 60 and lower, as a general, this is all a general rule, obviously. And obviously the other thing is, if you're doing extension and it's getting worse, you don't keep doing it. That's a trick you can do 5 times a day if it's working, until you get out of out of the pain. So an older person might do something like, let me see, get this here. So you're sitting here.
Yeah, put it back. What was it on before? The table?
Yeah, I'm gonna put it on table. So
This is your palm. There you go.
Yeah, older person might have somebody do like a rollout. And again, this is a repetitive flexion now.
Gotcha.
So in that way, you're opening up the space of your low back. That would be the older population would do that. So those are just little tricks that I can add in here. But before we talk about the main point of the video is going to be, we go back to that posture. Like I think I was very lucky early on to go to a course when I first graduated, that one of the main concepts of the course that I try to bring to everybody is the way humans were made. There is an alternating between every joint from your foot up to your neck. There should be this alternating stability and mobility as you go on the way up. I don't know if you ever heard that, but if we can focus on the low back and the spine area, we were made to have mobility at our hips, stability at your low back, mobility at your thoracic spine, and stability at your neck. Because of our posture, because of what we turned into as far as driving, sitting, computer work, that switched. So now most humans are stability from their hips, mobility from their low back, because we're sitting and we're turning from our low back, our lumbar spine. Stability from their mid back, because we're here hunched over and we're just turning from our neck, and then mobility from our neck. And that's why everyone has neck pain and low back pain. Yeah. Because areas where there's supposed to be stability, we've now evolved wrongly into getting mobility out of those areas. Right. So when I treat, that's the main concept that I go by, is that we need to restore to the normal patterning. So we talked about thoracic mobility and how that, and we do a lot of things to warm up hips and mobilize, get mobility from the hips, right? So, but that's kind of the main concept of why everyone has low back and everybody has neck pain. So to take that kind of one step further, I have another little, see if we can get this one on here. Where am I going? Right. All right, so here's the picture. So again, you have that, the one guy here is going to be your good posture, your normal posture.
Move back a little bit.
All right. Good. Yep. Let me switch so I can see what I got on the screen here. All right. So yeah, you can see the blue lines. That's normal. Everything is kind of balanced. He's in good posture. The guy on the left is going to be, you see the red areas and the green areas. So that is and it's kind of a cross pattern, right? So the green areas are showing places that are elongated and weakened. So that's abdominals in the front and your hamstrings and your glutes in the back. The red areas are showing places that are, because of posture, because of this, you could see that he has a bigger arch in his low back and a bigger hunch in his upper back, that kyphosis. So that's the normal population's posture nowadays, and that's what we've fallen into. Wow. So the red area is going to show places that are shortened and tight. So that's why most people are going to have hip flexor and quad tightness and low back extensor muscle tightness. And that's where we're getting a lot of our mobility, our locomotion from. Right. Although the green areas, again, the important areas, your abdominals and your glutes and your hamstrings, are elongated and weakened. So most of the population now is going to have these stretched abdominals and weak abdominals and stretched and weak glutes and hamstrings. So that's why we're always talking about take a step back, work on your core, work on that your neutral, the true core, which is your neutral spine, and work on glute strength. And that's also a big part of why everybody's weak in those two areas, because of that posture. So again, in addition to mobility, stability, we're trying to restore that. This is the main thing that we're combating as PTs every day when I treat low back. And we talked about why the postural stuff was important when we're treating shoulders, because of the position that it puts your shoulder in. Now that's the main concept of what we're treating when we're treating low back pain. So yes, there's the hands-on stuff that we do to try to loosen up those shortened and tight muscles in the back. We're releasing the tight hip flexors, stretching out your quads, and then we go into strengthening of your abdominals the right way,
Right.
and strengthening of the glutes and the hams the right way. So combating that, strengthening those things, that's the main concepts of what we're doing every day. So when I'm treating low back, do I care so much about what's going on as far as all the other things, herniated disc, bulging disc? A little bit, because if the nerve is pinched, then we want to, you have to get you out of that pain first. But the main concept is always going to come back to those two things and treating that. So where does that take us right now? Things we've talked about, mostly working on thoracic mobility to kind of get out of that postural positioning. And the way you do that is the thoracic extension, the thoracic mobility, but we're also helping out by loosening up those muscles that are tight, the hip flexor stretching that we talked about. Was it you that said that you have the so right?
Yeah.
So that's something that just came out. That is a way. That's physical therapists do that all the time. Release the psoas muscle. So that's a product that just came out. That's all over the place now to help you release that muscle at home. But stretching goes a long way too. There's all stretching stuff that we talked about. The kneeling stretch that we talked about in the last video. Standing quad stretch. All that stuff.